Thank you so much for coming to spend this weekend with us. We really appreciate it, and we really enjoyed your keynote and panel discussion that we just had. What first sparked your interest and passion in global health?
To me, public health, in some ways, it's one of humanity's greatest tests. You know, like we all say that we all deserve the same chance of life, and a life is a life is a life, and everything is equal, no matter your skin color, your income, or you're born. And in public health, we're really testing that. Are we as a global community willing to do what it takes to make sure that a child doesn't die or that a mother doesn't die, no matter where they're born, no matter how much money they have, no matter what means they have. And the good thing, the exciting thing about public health is that it feels so doable. Public health is hard, but we've seen so many gains, right? There really is no excuse for a child to die. There's no need for anyone to die from something that is preventable just because we haven't, as a society, got ourselves organized enough to get the medication to that clinic or to get sufficient funding to pay for that medication. So it's that, you know, the need and the importance of it and the doability of it, right? There's so much we can do.
I think it's fantastic, especially because a lot of people, as you said, can get very daunted by the idea of public health. It's such a big concept. And sometimes it's impossible to break it down into the smaller areas. What are some of the areas that you've worked in the past that have been your favourite or most fulfilling areas?
So there's a lot. My background is within public health is HIV, and we started with pediatric HIV, which felt odd at the time when I started doing this work, because people would talk about AIDS, they would talk about commercial sex workers and people who use drugs and gay people, and people forgot that there are kids who were born HIV infected, and it felt so hopeless and not a priority. But there has been so much that we could do there, right? When we started this work, the drugs were not available for kids, the tests didn't really work for the very young kids, and there were very few kids that were receiving treatment. And if, as a child, if you are born HIV positive, your likelihood of dying in the first 2 years of life are 50%. Half the kids would die. Whereas if you get the medications, you will live, right? And the amazing thing is, as a pregnant mother, if you are HIV positive, if you are on treatment, you will not transmit that to the baby, which is amazing, right?
It's amazing,
the fact that we can do that now.
So much progress.
Yeah. And now we have 800,000 kids around the world who are HIV positive but on medications, and it encourages their mothers to go and get tested, and means that their next pregnancy may not be HIV positive, the baby may not be HIV positive. So that has been very, very fulfilling. And the whole work on HIV has been very fulfilling, because I remember speaking to people about HIV 20 years ago, here in Australia actually, and people just said it's just so hopeless, people are dying. And when I speak to my colleagues who were in Africa at the time, there were funerals every week, and there were people walking in the streets skeletal, and then you see the impact of HIV medication. It is amazing. They call it the Lazarus Effect, right? Because people really come back to life.
Come back from the dead. Yeah.
And then we as a community really came together, you know. Nobody would have imagined that we could get 3 million people on treatment by 2005, but we did, and now we have almost 20 million people on treatment. And the world community got together and got this incredible amount of funding that would have been unthinkable. And so in some ways, if public health is a test, HIV is a test we are doing fairly well on. Not sufficiently well. We really need to get there. But it's been so encouraging to see what can be done if we just mobilize. And so that's been really, really fun and satisfying and interesting. And
It's a good case study.
Yes.
Yeah.
Of what can be done.
Yeah, that's right. Yeah. That's a great story. It's often, as a medical professional myself, and a lot of people here at the Global Ideas Forum are, but then a lot of us aren't as well, and yourself included. Yeah. So
I didn't know how to spell HIV when I first started. You know, literally, I had no idea.
And so, what would you say to those people who think public health and global health, who aren't medical per se, where they think that they can't contribute?
So I would say that public health, like many other fields, social sector fields, need a bit of everybody, right? We need medical doctors, we need managers, we need people who are good with finance, we need people who are good with people, we need people who are good with systems, we need creative folks who can help craft messages that would resonate. You know, we need programmers who will help to put together some clever applications. Right now there's a huge amount of progress in applications that are used in the field with mobile technology, for example, to advance various areas of medical interventions, malaria, HIV, etc. And so what I would say is, know what you're good at, know what the world needs, put the two of them together. Don't worry about not being a doctor, don't worry about not being creative if you're not. Focus on the piece that you are good at and what you can bring to the table, because for public health we need everything, right? And I think you would be most effective doing what you're good at, not don't go and study medicine just so that you can do public health.
Yeah.
Focus on whatever it is that you have to give.
Mm-hmm. Yeah, that's really great advice. And I totally agree. I think that's an ethos that Global Ideas shares, which is why we try and make our programs multidisciplinary and try and make all the content multidisciplinary and have people like yourselves.
And it's lovely to see an audience and over the last couple of days.
Elya, thanks so much for joining us here at Global
Pleasure.
Ideas 2017.